Well, a Veteran Affairs facility in Chillicothe, one of the oldest in the country, has been recommended to close its doors.
Tonight, we hear from the facility that says patient care is still its top priority, while one veteran says the recommended changes could have a major negative impact on those it serves. Here's 10 TV's Bryant Somerville.
A VA facility that has been in the heart of Ohio almost 100 years might soon be shutting its doors.
It's all so complicated and annoying that it's like, what do we even... Why? Like, why?
Nathan Connick served in Afghanistan with the 82nd Airborne Division in the U.S. Army. It was during a jump he says he was hurt. It started a long road with back pain and mental health issues. He's been going to the Chillicothe VA Medical Center the last year and a half.
Do you think, after reading these recommendations, veterans' best interests are at heart?
Not in Southern Ohio.
After a nationwide assessment of all 171 VA facilities across the country, it has been recommended to, among other things, close the historic VA campus, build an 80-bed community living center in the Circleville area, move 80 beds to Dayton, along with inpatient mental health services, and build a multi-specialty clinic in Chillicothe.
There's time right now for some changes to be made.
Stacia Ruby is the public affairs officer. To her right, Diane Garber Caldwell. She is the facility planner. They say specific plans, if the recommendations were to be approved early next year, have not fully been developed. What they do know, it is no reason for veterans to panic.
Even with these recommendations, the Department of Veterans Affairs and its VA services is not leaving the Chillicothe area completely.
They say care is still the primary mission for the more than 20,000 people it serves in 17 counties. Connick is in Scioto County and says his services would still be available. But his issue is with inpatient services, like surgeries. He says if a veteran has a mental breakdown and needs to be hospitalized, going to Dayton or Columbus or even West Virginia is not always a healthy option.
It becomes a problem because most veterans, when they get out, their support system is their family.
Garber Caldwell and Ruby want veterans to know, regardless of what happens, they will never have to re-enroll in VA health care, and that being enrolled entitles them to health care across the country.
We want them to continue with that security that we're here for them and that we're going to do everything we can to continue to be here for them.
In Chillicothe, Bryant Somerville, 10 TV News.
Stacia Ruby says if people want to speak in agreement or disapproval of the recommendations, to speak to their state leaders. In January, the recommendation will go to President Biden's desk. Congress should vote on it by the end of next March.